Chapter 20 is going to cover allergic reactions. The immune system's job is to respond to any foreign substances in the body, whether it be allergen, infections, anything. So an allergic reaction is essentially an exaggerated response to that foreign substance. An allergen being that foreign substance causing that exaggerated effect. Inside the body, what's happened is at first exposure, the immune system forms its antibodies. Those antibodies identify and attempt to attack that particular foreign substance, so attacking that allergen. The antibodies will combine only with that allergen that they were formed in response to. So the next time the secondary exposure to that allergen, those antibodies are existing and they're going to combine with an allergen that's going to cause the release of the histamine and other chemicals into the bloodstream. Those chemicals can cause harmful effects, so that overproduction of everything, just the body over exaggerates, gets way too excited to be forming that those antibodies and fighting off the foreign body substance. Outside the bodies, those effects of histamine and those other chemicals are taking effect, causing inflammation, bronchoconstriction, vasodilation. An anaphylaxis is the life-threatening allergic reaction. It causes rapid dilation of the blood vessels. They open way up, so it could make them become hypotensive, have a complete ultramental status, causing airway swelling, upper airway obstructions, complete bronchoconstriction, and ultimately respiratory failure. The reason all that happens is as those foreign bodies are recognized in the bloodstream, the body's reaction is to dilate. So everything that's in there is going to be harder to get outside the bloodstream. So it takes that big pipe, takes that small pipe, makes it bigger so that those foreign body substances won't kind of touch it. So his blood vessels essentially thinking that that foreign body has cooties, so it's trying to spread away from it, doesn't want to touch it. The airway will constrict because it senses that it could be breathing stuff in, so it's going to constrict so that you don't inhale any more stuff. Just a weird, crazy, overcompensating mechanism to it. The most common allergens are insects, foods, plants, and medications. The most common are bees, shellfish, and peanuts. Also in that plants, you can think about poison ivy, stuff like that, but general allergic reaction with that, not necessarily anaphylaxis, but peanuts, shellfish, bees, the top three killers. There's also latex allergies. It's more of a common thing than what a lot of people think, so it's a big thing to be considered of in EMS, as some things on the ambulance do contain latex, such as gloves, tape, but anymore a lot of the manufacturers make everything latex free just because so many patients have a sensitivity to latex more so than a true allergy. Those allergic reactions may take place from anywhere from immediately up to 30 minutes, hour. It just, every person's different, so there's no way to actively predict exactly what's going to happen. A lot of things go into that, the extent of their allergen, the type of exposure, multiple things go into it determining how fast that allergic reaction or anaphylaxis may develop. The skin will itch, have hives. I think everybody's been exposed to bee stings or poison ivy or something like that. So you've seen the hives, the redness, the swelling, that warm or burning sensations. If it's localized, that's just an allergic reaction. So you can see the redness, the swelling of the face, of the eyes, upper airway stuff can be a major factor in that. So just imagine if this picture, if he was swelling a whole lot more, then that could close off the entire upper airway. More localized hives, seeing those, that can, if that's up around the neck, that can spread wildly across the body, causing those hives globally. Respiratory, getting that tightness in the chest and that cough, and that's all just due to that bronchoconstriction. You may have stridor or wheezing as the upper respiratory tract will constrict down. Cardiac, increased heart rate because it's trying to keep up that cardiac output of the vasodilation, so that heart rate's going to be kicking back up, trying to maintain that good even cardiac output. Having the general allergic stuff, itchy, watery eyes, runny nose, headache, everything kind of goes into the general allergic reactions, except that sense of impending doom when they get encounter something that the patient may know they're allergic to, or it's something that's new they didn't know allergic to. They could have that sense that, oh God, I'm about to die. So with that when they're in shock, the high heart rate, the low blood pressure is also going to cause the pale, cool, clammy skin or dry, and the change in mental status. So if you're starting to see that person experiencing syncopal episodes, any involvement of respiratory issues, very bad. So that is the major differentiating thing between allergic reaction and anaphylaxis is respiratory distress or signs and symptoms of shock. And once again, those signs and symptoms of shock is the increased heart rate and hypotension. Big focus, airway, breathing, circulation. The airway is going to be the big determinant of the anaphylaxis, so it needs to be managed aggressively, providing oxygen, ventilating if needed. And always don't forget about getting that assessment and getting the type of allergies exposure. What exactly were they exposed to? How are they presenting? And what do you need to do to fix it? Get those baseline vital signs to assess whether the patient is truly in shock or not. A lot of patients can present saying they're in anaphylaxis, and it's just a simple bee sting causing no swelling, no breathing difficulties, no shock. So being aggressive with those airways, providing supplemental oxygen, 15 liters non-rebreather, and don't be afraid to start ventilating that patient if need be. Most of those reactions, though, aren't going to require any interventions, but maybe a trip to the hospital and some Benadryl just to be checked out, have some blood work done. If you need to assist the patient with an epi auto-injector, as this is taught on a national curriculum, it's taught as to assist with the auto-injector. Only do so with consultation of medical command. Also, the same will go true as if you do carry EpiPens on your apparatus. You need to consult with medical command to be able to give it, and only giving it to those patients who are in shock. After you've used the auto-injector, you need to be sure to reassess that patient continually and transport them. That medicine may wear off, and that may be the only auto-injector you have, and it can wear off and they need subsequent doses. So always be sure to transport that patient. The EpiPen, it's prescribed. It's an expensive prescription. It's not something you can just go pick up at the CVS to put in your first aid kit in your vehicle. Epinephrine is essentially a synthetic adrenaline. It's naturally produced by the body. It will constrict the blood vessels and dilate the bronchioles. Since in anaphylactic shock, those blood vessels dilate and the bronchioles constrict, this is going to reverse those effects. The EpiPens are auto-injectors. So basically, it's the same thing as manually drawing up the medicine and giving a shot, except it's a spring-loaded needle inside. So whenever you impact the body with that EpiPen, it injects that needle in, that automatically releases those medications, the epinephrine that's within that auto-injector. So instead of just having to manually draw up the medicine, then give a shot, and then push a syringe to deliver the medicine, this just does everything automatically. So some side effects to the epinephrine is it will increase your heart rate from that vasoconstriction, and will increase that cardiac workload also from that vasoconstriction. So this is one of the most common EpiPens, as you see here. A couple things to note about it is if you read here on it, there are 3 simple steps. One is to remove the blue cap. As you see right here, remove this blue cap is step number 1. Number 2 is you swing and stab firmly and hold it for 10 seconds. So number 2 is hold with a tight grip and then swing and stab in the meaty part of the leg, generally in the thigh. Now this needle can go through skin or I'm sorry, through clothing. So if they have on a pair of jeans, just pull the clothing really tight and deliver the medicine through the skin, through the denim. And then the safety cap down here will cover up the needle, so you never see the needle. So whenever you puncture, whenever you push it against the skin, it will disregard the safety device in there. The needle will come out, and then once you withdraw it off the body, that cap will go back over and cover the needle. So a couple other basic things to it. Besides reading the instructions here, you've got a little clear view window here for just regular inspection of it. And like I said, everything, it was just manually operated. So once you do administer it, you need to record the time and then dispose of it in a sharps container. If it's a 2-dose injector, which are very rare, don't disregard it as it has another dose remaining. Then always just keep an eye on the patient and see if any additional doses may be needed. If they're still short of breath, hypotension, if they're still in shock, they may need another dose of epinephrine. This generally requires online medical direction, as well as sometimes the initial dose may require medical direction as well. If you don't have the auto-injector, there are places where in our state of West Virginia does allow the EMT to give epinephrine manually. So as EMTs, you can manually drop the medicine and give the shot. And this is becoming a wider spread thing just due to the cost of the auto-injectors to be able for the EMS agencies to be able to afford to stock them. But if you don't have any access to epi, request ALS immediately and treat for shock. There are 2 sizes of the auto-injectors. There's the adult dose, which contains 0.3 milligrams, and there's the pediatric dose that's half of that, 0.1 milligrams. So for the pediatric dose, that's for kids less than 66 pounds or 30 kilos. Up next is a video from the doctors explaining anaphylaxis.
I do want to highlight to everyone what happens during an anaphylactic reaction, because there is a difference between just a localized allergen or allergic reaction and true anaphylactic shock. This word is key because your body literally goes into shock when you have one of these reactions. Now, it can happen with foods, medications. It can also happen with insect stings, with a bee sting, for instance. Because what happens is when you're exposed to this allergen, whichever one it may or may not be, your body responds to it. This allergen, your body recognizes it as a foreign invader. It attaches to these antibodies, and what happens is these mast cells degranulate all this histamine. Now, if that histamine is just local, you might get a little local reaction. You might get a little bit of hives on your skin. But unfortunately, what can happen when it comes to anaphylaxis is within minutes of exposure to an allergen, food allergies, for instance, an anaphylactic reaction can occur where you get swelling of the mouth, swelling of the tongue and lips called angioedema. You can actually get constriction of your airways, making breathing more difficult. Your airways may constrict, but what happens is your blood vessels may dilate and you'll have a systemic drop in your blood pressure. As all these things happen together, if you do not respond, you can die. And I'm not talking die in hours. I'm talking within 10 minutes, if proper treatment is not given, someone can die. Now, what we have, luckily, is something called an EpiPen. This can be truly life-saving. This staves off what we call circulatory collapse. I want everyone to look at this label very closely. All you have to do is read. It's quite simple. You're going to pull off the safety release, okay? And then you want to put it into a bigger muscle. So the thigh tends to be a very good spot for that. And literally, you're just going to auto-inject into the thigh, hold it for 10 seconds, and then you're going to want to call 911 and get help. Because without this, and I have to ask the two of you, I'm assuming that your friends, you've taught your friends how to use this?
Yeah, most of my friends know how to use it.
Because what you're going to see is, if your friend, if your friend has anaphylaxis, they're going to have potentially difficulty breathing. You're going to see potential swelling of the lips and tongue. But if they look in extremis, like that model over there, That's time. That's when it's time to grab the EpiPen. Well, thank you all so very much for joining us. Best of luck.